Hi, my name's Jessica Grice, and I am the practice manager here at Carolinas Dental Sleep Center. And today I just wanted to talk to you a little bit about the Stop Bang questionnaire that you can find on our website. The Stop Bang questionnaire is a resource that we have available to patients, and it's a simple 8-question survey that is a good indicator of the likelihood that a patient actually has obstructive sleep apnea. The questionnaire has been scientifically validated for its accuracy, and as I mentioned, it's very, very simple. But to really understand the relevance of the questions, you need to understand exactly what sleep apnea is. So obstructive sleep apnea, the best and easiest definition is that it's a disorder in which the airway is intermittently blocked during sleep. And because of this blockage, this leads to snoring, pauses in breathing, drops in oxygen level, and gasping and choking during the night to try and regain normal breathing patterns. So Stop Bang is an acronym, and each letter in the acronym stands for a different question. So if we start with the S, S stands for snoring. Do you snore? 90 million Americans actually snore in their sleep, and 50% of those will have obstructive sleep apnea. While temporary intermittent snoring is probably just considered a nuisance, loud, persistent snoring should be a cause for concern. T stands for tiredness. Are you excessively tired during the day? Do you have trouble keeping your eyes open after you have lunch? Have you ever fallen asleep at the wheel? Now, the excessive tiredness that people feel is not just a symptom of having a busy life. It can actually be a symptom of obstructive sleep apnea. And the reason that this occurs is because when you stop breathing in your sleep, the brain sends a signal to wake you up and make you resume your normal respirations. And even though the patient may not be aware of these awakenings, they're actually fragmenting the normal sleep pattern, which decreases the quality of your sleep and leads to the excessive daytime fatigue. O in the Stop Bang survey refers to observe, and this is the simplest question to answer in the survey. Has anyone ever observed you stop breathing in your sleep? If they have, this is a very good indicator that you probably have obstructive sleep apnea. P stands for pressure, or do you have high blood pressure, or do you take medications to treat high blood pressure? Approximately 50% of patients with obstructive sleep apnea have hypertension or high blood pressure versus 30% in the general population. For every apneic event, or every time you stop breathing in your sleep per hour, there's a 1% increase in the odds of developing high blood pressure. For every 10% drop in nighttime oxygen levels, the likelihood of developing high blood pressure increases by 13%. The link between obstructive sleep apnea and hypertension hinges on the oxygen deprivation. When oxygen levels drop, your brain sends a signal to your body to constrict the blood vessels, which increases the blood pressure in order to get oxygen to the brain and the heart quicker. Unfortunately, the hypertension that you experience at night because of sleep apnea carries over to the daytime. B in Stop Bang stands for BMI, or your body mass index. Do you have a BMI that's 35 or greater? BMI is a comparison of your weight relevant to your height, and anything that's 35 or greater is considered obese. With each unit increase in BMI, there is a 14% increase risk of sleep apnea. A 10% weight gain increases the odds of developing moderate to severe sleep apnea 6 times. And compared to normal weight individuals, those who are obese have a 7-fold increase in developing obstructive sleep apnea. A is for age. Are you over 50? As we get older, the risk of obstructive sleep apnea increases, and the prevalence of sleep apnea is greatest in those that are 50 or older. N is for neck size. The reason this is important is because the greater the neck size, the more tissue there is to collapse, which contributes to airway constriction. For men, the risk increases if the neck size is 17 inches or greater. For women, the risk increases when the neck size is 16 inches or greater. The last letter is G for gender. Are you a man? Men have a higher prevalence of obstructive sleep apnea than women do. Gender can affect things such as fat distribution, the anatomy of the airway, chemical and neurological mechanisms behind obstructive sleep apnea, fat distribution, and sex hormones. All of these things can increase your risk for obstructive sleep apnea. Now that you have a better understanding of obstructive sleep apnea and the Stop Bang questionnaire, we invite you to take the survey for yourself. If you have an increased risk of obstructive sleep apnea, please call Carolinas Dental Sleep Center and set up a free consultation. We would love to help you.